So next, I want to invite Dr. Nichola Davis, Vice President and Chief Population of Health Officer at the New York City Health and Hospital Corporation. Dr. Davis.
Great. Thank you so much. And thanks for everyone that's here on this call. It's so exciting to just see this interest in lifestyle medicine. So similar to Dr. McMacken, I'm also an internist by training, and I'm an obesity medicine specialist. So similar to Dr. McMacken, going through medical school and going out in practice, we were always treating patients with diabetes, hypertension, so many of these conditions that I always felt, well, if we could just help them to eat healthier and to lose weight and to do all of these things that we knew could really improve their outcomes instead of just focusing on medication, right? But we just didn't have the skill set, I think, as most doctors do, because we didn't have the training, but there was a lot of interest in how do we do this. And so this was something I really became passionate about as I worked in the Bronx. I've done all of my clinical work in the Bronx, and I really just felt like there has to be another way that we can help patients that just didn't involve adding more and more medication. How can I help them to lose some weight? How can I help them to adopt some healthier lifestyles? How can I help them address the barriers that they may have to adopt a healthier lifestyle? So I was beyond thrilled to help Dr. McMacken launch the program at Bellevue several years ago. And I am so excited that we're now able to launch this across the system. This is, I think this is a dream come true, right? This is what our patients need. This is what they deserve. And this is really critical in being able to provide this equitable type of for our patients, where we can actually, not just tell them eat more fruits and vegetables, right? As doctors, this is what we generally do. We give them this advice: eat more fruits and vegetables, exercise more, lose weight, and that's what we do. That's what a lot of primary care docs do, and that's good advice. But the recommendations are vague. And through the lifestyle medicine program, we're now going to be able to really help patients, give them the support through health coaches. What a dream! Through dietitians that are focused on plant-based medicine, to really help them to make these concrete changes so that they can achieve these outcomes. So not just the advice, but really the advice plus the tools, plus the skills, really empowering them and partnering with them so that patients can really achieve these goals. And this is going to be critical for us in terms of improving our population health, reducing the rates of diabetes in our community, reducing the rates of high blood pressure. So I'm really excited and looking forward to the launch of this program.
Thank you, Dr. Davis. Now we have Lillian Correa. She's a registered dietitian and at the plant-based lifestyle medicine program at the New York City Health and Hospitals Bellevue. Lillian?
Thank you, Jose, and thank you, everybody. We're so excited to be here. I'm so excited to be here and be part of this conversation. As a dietitian, it's just such a privilege to be able to work alongside physicians like Dr. McMacken and Dr. Davis to bring patients, this lifestyle medicine approach, this multidisciplinary team approach, like the one that we have at our lifestyle medicine clinic at Bellevue, really allows for a whole person approach, for patients to just help them bring the tools that they can achieve the most optimal outcomes. And it's so exciting to see that these programs are being expanded to all these communities, and the communities that are really affected are most vulnerable populations. So for example, in the Latino community, that's something that is very close to my heart, as I've seen many family members, many friends in my community succumb to diabetes, for example, diagnoses. And a lot of times, these types of diagnoses bring about a sense of hopelessness, and we have all of this information that, for a number of years, lots of information that was available a lot in English, for example, but maybe minimal resources for Spanish. And so bringing this information, this education that actually can bring hope is such an amazing tool, because then people don't have to feel like maybe they have to give up some of their favorite foods, or people will understand that this isn't something that is happening to them, that they can actually happen to it, right? And then they could have something that will help them to achieve the most optimal outcomes. Now, I learned about lifestyle medicine, specifically about nutrition, early on in my education at Loma Linda University, while I was doing medical missions abroad. So what I learned there is that when medications are gone and healthcare is not accessible, like we just saw recently during this lockdown in 2020, particularly when healthcare systems collapse, like in my country, in Peru, we have lifestyle medicine. And every single one of us can have tools at our disposal that we can really use to tip the scales, right, in the favor of more positive health outcomes. So in this way, we can enroll our patients in the possibility of living their most optimal lives by using these tools that lifestyle medicine can provide.
Thank you, Lillian. Just wanna Anais, can we check if Dr. Mitchell Katz is available yet, or before we start the Q&A? First, I want to say that I'm really interested, as a as a person, really interested in this topic too. Since last year, when I was in the campaign with Eric Adams, we talked a lot about plant-based, about nutrition, and believe me, in the last few months, I have changed my habits in a radical way for much better nutrition. So we're going to start the Q&A today. So due to the high number of reporters that we have today, so we're going to have one question per reporter. And we are going to, if we have time, we're going to do a second round for follow-up questions. So please, if you have a question, raise your hand on the screen so I can see who is raising the hand. If you can do that right now, who have questions. So I'm going to start with the round of questions today. So we are going to do some balance. We have many reporters here from all the communities. Thank you again for that, for this participation. So we're gonna diversify the whole Q&A today. So let's start with Angie Damblaki. Angie.
Yeah, hi, how are
Hi.
you? Hope everything is good. So just I want to know if there is another languages other than Spanish. So is there a language access in this program for patients from other communities, like, Arab, any other languages, or Asian community?
Yes, absolutely. So we serve patients who speak, diverse number of languages, and we use interpreter. We have professional interpreter services that we use with every patient. So because in our program, we're offering a lot of individual support. When we don't necessarily have a group session that's in the patient's primary language, we offer additional individualized support using interpreters if necessary. And I think it's a really important point too, that it's not just about what language that we're using. It's about the whole culture. What's the person's cultural background, and how can we really tailor our advice to be relevant for that person and their family? So that takes really a lot of listening and understanding where people are coming from.
Mm-hmm. Thank you. Thank you.
Thank you. Now we have Mona Davis from Little Africa News. Mona.
Hi, good afternoon, everyone. Thank you, Jose, for organizing this. And thank you so very much to our medical professionals for launching this program and now rolling it out citywide. It's wonderful. So my question to you is this: how do you plan on notifying communities and increasing awareness about this program in all of our communities throughout the city? What is your strategy to get this out so that everyone will find out and learn about this, this great program that can really help them change their lives? Thank you.
I can, so So I can speak to that. And of course, Dr. Davis and Lily, if you want to jump in, you're welcome to. But, you know, I think that it's events like this, first of all, and I'm so grateful to the Office of Ethnic and Community Media and Jose for this event. And we're hoping to have more so we can really get the word out, because we're really relying on word of mouth within communities, between patients and the media to help spread the message. We're also, you know, for the patients who are already, individuals who are already patients within the health and hospital system, we are definitely going to be having a big promotion there and being able to message patients. We're letting all the providers, all the doctors and others know about this so that doctors can refer their patients and other providers can refer their patients. And, you know, we're really trying to just sort of spread the message as best we can in the communities that need it most. And we're going to be, you know, just a huge push for that.
Thank you. Dr. Davis or Lillian, do you have any comments? Please join the conversation, you know, when any of the questions, if you have any comments, so just let us know.
Yeah, I just wanted to add, thank you, Jose, that in terms of the word of mouth, you know, being leading the groups in the program that we have at Bellevue, this is something that our patients have been asking for, you know, for their friends. And we've had a lot of referrals, of word of mouth referrals, and people who are excited to share and asking, how do I get my friend to join this program? They're very interested, you know, and so that is very, very powerful, that we have this word of mouth as well, and that they're going to have clinics where people won't have to travel, for example, as far. You know, some of our patients initially, when we first started this program, were taking 2 buses and a train, you know, to get to us. And now to make it more accessible is just going to be great.
Thank you, Lily. So next we have Anna Peckerman from Rusa Radio. Anna.
Hi, thank you so much. Thank you for organizing this. And this is super exciting and interesting as well for me. And, you know, I represent a community of foodies who are very big into food indulgence. And basically, I'm interested to find out, is there going to be an educational program for people who are not necessarily already having problems and suffering from diabetes or other you know, diseases related to eating improperly, but prevention, because I mean, I think the whole idea of plant-based programs is fantastic, but I think it's, you know, to give people education, not to get to the point where they're already sick, but how to change their lifestyle. I mean, Mayor Eric Adams is a great example, and I think it's fantastic that, you know, he's leading this movement. So will we have education so we prevent diseases, not just treat them? That's my question.
I love that question. So I think that we have, you know, as far as my, you know, role in this leadership role at Health and Hospitals, and I know Dr. Davis is heavily involved in this as well, we're really looking at providing education across many different levels. So the first is these dedicated lifestyle medicine programs, which do include individuals who have pre-diabetes and who are at high risk of developing type 2 diabetes. And this is really a really golden opportunity to lower their risk and try to prevent diabetes, and can be very effective. As far as more broadly in the primary care and other communities at Health and Hospitals, other programs, we're actually going to be rolling out initiatives to provide additional nutrition and lifestyle education to all of our providers at all different levels. So from the physicians to the resident doctors in training, to the nurse practitioners, to the farm, you know, the PharmDs, to the nurses, to the medical techs, everyone's going to get some form of, you know, an opportunity for some form of training around nutrition, so that we can really weave this into the fabric of how we deliver primary care and other services, so that all patients will really have that exposure. And I know, Dr. Davis, you can probably speak to some of the other initiatives that are planned around diabetes prevention.
Yeah, definitely. I agree with what you're saying, Dr. McMacken. I think it really has to get woven into the fiber of the way we practice medicine so that there is that emphasis on prevention. And to do that, we do have to educate our providers on how do we talk to patients about, their diet in a meaningful way and the importance of their diet in terms of preventing illness. We are also launching the diabetes prevention program at Health and Hospitals. We actually just started it a few weeks ago. Which will be launched across the system, another dream, which is really focused on using, diet and exercise and helping patients to achieve a modest amount of weight loss with the goal of preventing diabetes. That's a very well-known evidence-based program that shows an amazing reduction in diabetes for those who have prediabetes. So patients are going to have multiple different ways of accessing the health system in different ways in terms of just focusing on their nutrition and their lifestyle that they really haven't had before. So I think it's really now going to become a fabric of our health system, which is amazing and really important. So it's going to touch our patients in different ways.
Thank you, Dr. Davis. So before we go to our next questions, I want to welcome Dr. Mitchell Katz. I think he just joined us as the president and CEO of the New York City Health and Hospital. Dr. Katz, are you?
Thanks so much, Jose.
Great.
Just to add, as a proud primary care doctor at Gouverneur, I see a large number of Latino patients and Asian patients, and I always make giving dietary advice an important part of the visit. It's an important part of how you prevent illness. And I love what Michelle is doing and leading in the lifestyle medicine. I think it takes us to the next level. So thank you all for being here and for getting out the message about lifestyle medicine.
Thank you, Dr. Katz. Next, we have Javier Castano from Queens Latino. Javier?
Yes, you can hear me?
Yes.
It is glad to hear that the Bellevue program is working and is going to be implemented in the city of New York. But the Mayor Eric Adams is talking about how this prevention medicine has to be seen by the racism and the exclusion in the city of New York. That has to be gone. So my question is, we, the ethnic media, we are going to take care of the information. That is important. But when I go to the supermarket and I see the price of a lemon, and when I see the price of the onion and potatoes and other vegetables and fruits, it is almost impossible. So what the city is going to do to provide those products in a cheaper way, I guess.
Yes,
whether Nichola wants to talk about some of the SNAP benefits in other ways, Michelle.
Sure. Yeah, I completely agree with what you're saying there. The price of healthy foods is really challenging, right? And it's challenging for our patients. And I think that one of the things that we work on with our patients is how do they address those barriers, right? So how do we help them to afford these healthier foods? So things like assessing them for food insecurity, enrolling them into benefits or helping them to enroll into benefits such as SNAP. We've worked with getting farmers markets at our facilities. So we do have so our patients would have access to those fresh fruits and vegetables. We've worked with the Department of Health in terms of getting health bucks for our patients. So we look at all of these different ways of trying to make produce more affordable and available for our patients. But I agree, big picture is how do we address it, like at the grocery stores? And I think that that's a really important question. But I think for us, we're really trying to work with our patients in addressing those barriers by making sure they're able to avail themselves of the benefits, as well as bringing farmers markets in close proximity to our hospitals, and really finding ways to make it more affordable for the individual patient.
Thank you, Dr. Davis. Next, we have Wang. Can I ask each one of the reporters if they can identify the outlet? Gigi, I think you are on mute.
Can you hear me now?
Yes, we can hear you now. Thank you.
MEE from Sinovision. My question is, what's the #1 reason of death rate among Asians in terms of chronic disease, and how lifestyle medicine and plant-based nutrition can benefit those group of people and help them develop or improve their lifestyle and health condition? Thank you.
I think that what we're seeing across many communities is still just the very, very high rates of type 2 diabetes and hypertension, as well as high cholesterol. Those are very common. And we know that what we know about a healthy plant-based diet, so really a diet that's rich in fruits and vegetables, as well as legumes like beans, lentils, tofu, talking about grains such as brown rice, nuts and seeds, and really emphasizing and celebrating those foods at the center of the plate. We know that's an approach that is linked to huge reductions in the risk of type 2 diabetes, reductions in the risk of heart disease, which is really the #1 killer across all individuals living in the United States, and reductions in the risk of high blood pressure and other outcomes. So we also know this is an approach that's very effective to actually treat many of these conditions, and sometimes with medication, sometimes alone. So I think that it's really an approach that works for a wide range of conditions, and that's why we're using that nutritional approach in our program.
Thank you, Dr. McMacken. And now we have Greg McQueen. Greg?
Hi, good afternoon.
Good
this
afternoon.
is Greg from the Manhattan Times. I think it's important that this lifestyle medicine program is expanding, but it's still only going to be available at a handful of H&H locations right now. So for a patient who lives in Harlem, for example, which is a neighborhood with really high rates of diabetes and heart disease, would they be referred to, say, Bellevue for these services? I know it's not at offered at Harlem Hospital currently. How are you ensuring that you're reaching more people who would really benefit from this program, but don't necessarily live right near those 6 hospitals?
Yeah, great question and great point. So I think that, Bellevue is a hospital that serves patients who are coming from all boroughs of New York. But I do, as we've said earlier, I do think it's really important that we have services where patients live to make it more convenient for our patients and improve access. So what we're talking about with this dedicated program expansion, this is really just the first 6 sites that we're talking about. This is phase 1. And what we're hoping to do is roll this out in the future to potential additional sites. The other piece is that we're actually able to do a lot of our program virtually. So that makes it much easier for patients who, for whom it's a struggle for a lot of people to take buses or trains or get into the hospital. So we are able to meet people where they're at by doing a lot of this through telehealth. And we have found that to be very effective. It was sort of one of the silver linings of the pandemic, that we learned how to do this effectively through video and phone.
Thank you, Dr. McMacken. So now we have Roberto Garcia from Option, New York. Roberto?
Yeah, good morning, everybody. Great opportunity to thank all the people, all the doctors that finally are seeing that just no medicine is good for health. My question is in 2 ways. People with Anna asked something like that, but I don't know, I was playing the answer. People that are like healthy could access that program so they can not go to the point that they need it. And also, if that program, you think that probably the school also has a next expansion, because we know that the school is the base for learning good habits. And a lot of people complain that the food that's served in school are not the best. Thank you.
Yes, I think that it's really key that we make sure that this type of approach, as Dr. Davis was saying, is really part of the fabric of how we practice medicine across health and hospitals, so that food first, lifestyle first, whenever possible, to the extent possible for each patient, and medications as needed. And so that way we can do our best to prevent some of these conditions. And our dedicated programs really exist for those who are living already with some cardiometabolic condition, so that they can actually get healthier. And in many cases, what we've seen, and I know Lily can attest to this, is our patients who make changes influence their family members. Their kids are influenced. The whole household starts to move in a healthier direction. And that's a wonderful thing to see. I do think that it would be wonderful to, moving towards family lifestyle programs is another wonderful idea, because we really want to capture parents and children together as they can grow into a healthier lifestyle. So all of those are excellent points.
If I can just add to that too, and to go back for a second also to Anna's question, which I heard foodie in there, and that,
yes, please.
That kind of pricked my ear up there. One of the things that it's very, very important to is definitely to help people make plant-based foods that taste delicious, right? Because we have this conception sometimes about healthy food being not delicious, right? And so one of the reasons why I came to New York, for example, is to do a culinary program at the Natural Gourmet Institute, because I really saw that connection, that I have to help my patients bridge this gap of, or this misconception that healthy food has to taste bland or boring, right? So one of the things we really, work to do within our program, and one of the things that we want to seek to do with some of these community educational programs and partnerships that we're going to have, is also to help people really explore the culinary adventure of plant-based cuisine. It really can be such an eye-opening world. When I became plant-based, I just discovered so many different things to do with vegetables, so many colorful ways, so many ways to season them. And that's something really to also explore. On average, Americans, we rotate about 5 to 7 different dishes, for the week. And so we kind of get, in that rut of, not rut maybe, but that's just the routine, right? That we have these go-to dishes. And so that's the other exciting piece, is really to helping people, just open up and expand this culinary adventure into the plant-based world.
Thank you, Lillian. Next, we have Hey Lee from Korean Radio. Hey Lee, okay, you're here.
Yes, hi. It's really happy to hear about the healthy lifestyle supporting program, and I think it's really meaningful milestone. But I just wonder, who can apply the program? Only patient or just normal? The citizen can apply the program, and how can they apply for the program? I want to know the process or website or application. And one more thing is, does it covered with the insurance?
So I can answer that. So our programs, our Bellevue program right now is the first one open. And as we open the other 6 sites, all of them are available to anyone in the city who qualifies based on clinical criteria. So we'll have 2 ways of referring patients. Individuals in the community can hear about the program and call our dedicated number to get an appointment. And then they will be screened to see if they qualify. And I can put the phone number and the website in the chat in a minute. The second way that patients can be referred is through their provider. If they're already a patient at health and hospitals, we'll have an internal referral system. So it's really open to a vast number of people who qualify. And so we're emphasizing the individuals who are living with either pre-diabetes, type 2 diabetes, high blood pressure, heart disease, or health concerns related to their body weight, to obesity. Those are the conditions we're focusing on in this phase.
Oh, Jose, I think you're on mute.
I'm really sorry about that. So I said that before we go to the next question, I want to read one question that we got on the chat. It's related to the prior question. It said that how can we involve the family members of the patients in helping them on a daily basis, a home support to change their lifestyle? So this is about involving the family members. So how come, what is your advice for that, for involving the family members?
Lily, do you want to take that one?
I can speak to that. Thank you, Dr. McMacken. One of the things that we really encourage during our consults, especially during the initial consult too, is to actually come with family members to the consult, right? Because that way we start to involve all of the people who are cooking at home, or, you know, I encourage everybody to bring partners, bring, you know, sometimes when we used to have appointments in person, you know, when that happens again, I used to have a whole family in my consult room, for example, right? So that's one way from the get-go to have people be involved in care. The other way is, you know, what we talk about in our classes is really to introduce familiar foods with a plant-based edge, right? So for example, tempeh taco Tuesdays, right? So it's something where it's fun, but and it's familiar. Everybody loves Taco Tuesday. Maybe you're introducing tempeh in there, or maybe you're having, you know, bean tacos or bean burritos. You know, something that's already familiar. And that way we just include more plant-based foods into our family dinners and our family lives, right? And it could be plant-powered pizza night, right? So I try to, well, especially when patients have kids, you know, try to have fun titles, and also it really is great when parents are putting their kids in the cooking process. That's always very educational and very fun, you know, and bonding experience for both of them, right? So we can do an overnight oats bar too, where we have mason jars that we set out, you know, and then different fruits, different nuts and seeds, right? And then the kids can pick their own toppings for their overnight oats, right? So those kinds of ideas that really start to just get more plants in the home.
Great ideas, Lillian. Thank you very much for that. So next we have Sunu Africa Radio. El Hadi and now.
Oh, thank you. Thank you, Jose.
Yes.
Thank you, Jose. Good to see you. Thank you, everyone. Most of the question was already asked. I'm just going to jump in straight to really thank our doctors. You know, it's very important because we need to all be healthy. And I believe if New York City is healthy, believe me, America is healthy. The thing is this, we are immigrant. I'm from Sunu Africa Radio, representing Sunu Africa Radio, of course, from originally in Africa and Senegal. And our community are mostly like West Africans, but African in general. And they all listen to our radio and go to our website and read our newspaper and so on and so forth. When we came into this country, I attempt to say that we usually was really, don't get me wrong, healthier. For some reason, the food we eat over here make us, I myself have high blood pressure. The thing is this, it's not everybody have the chance that I have to be able to maybe attend meeting like this or have access to knowing where to go when I'm really sick. In our community, usually they always wait when it's too late to go to the hospital. So I think it will be interesting to know. We know the mayor is doing a lot of cuts, which is important. It would be great. A lot of people ask that question: where can they really help the community? We know most of them have Medicaid. Some of them don't. Some of them go to certain communities that will help them, nonprofit and so on, so forth. But this is so important. My question is there's a way they can really, this is so important. I myself, like I just said, I have a high blood pressure.
The question, yeah,
is like, can they really come to our shows, the doctors and so on and so forth? And can they really advertise like they do on every other medium? So when they hear it over and over again, I think something can get done. Thank you, Jose, again.
Yeah, I can take that one too, because that's the goal of doing these roundtables. And yes, we were talking before the roundtable about what's going to be the next steps for bringing the message to the communities. We're gonna start programming some interviews with community and ethnic media and with the specific doctors from hospitals and the different programs, and we are going to work on that. So we're working on that. So in the future, we're going to have these doctors on your program. So our next person is Philip. Per.
Hi. Okay, thank you. So I'm Pearl Philip, representing Caribbean American Weekly, the Immigrants Journal in English, Spanish, and French Creole, and Workers' World Today, as well as our other multicultural radio programs. Just want to thank you, Mr. Bayona, for putting together this event, and kudos to Mr. Adams for bringing this initiative to this level, because really our communities are the ones that suffer the most, as the doctors articulated, from all those diseases. And really just having the right information and making the right decisions could go a long way in alleviating the diabetes, high blood pressure, etc. So what I really wanted to know is that since our communities are so affected, is there going to be a special campaign, both in terms of editorial and advertisements, that we can, get directly to our communities? Because we are the ethnic media, our communities are the ones that are affected. So are we going to have that, support, whether it's radio, digital, print, that we can get that message directly to our communities? And we're going to provide that information, through our various media, but we also need the paid support for our media as well. So is there going to be a special promotional campaign for us? Thank you.
Well,
yes, go ahead.
I was just going to say, I really appreciate the question, and it's incredibly important to us to get the message out to, all the communities that everyone here is representing. So I think that, Jose, when you were saying we're talking about additional interviews and additional media, I can't personally speak to the advertising component myself, but I definitely know that it's a huge priority to get the word out as best we can.
Yes, we're going to follow up with you, Per, about that, and with all of the other outlets that are also have that question in mind. So next we have Fern from the Jewish Voice. Fern Sidman. Fern,
Hi,
Hi.
Yes, I'm here. I'm sorry you can't see me, but I can see you. Firstly, thank you, Mr. Bayona, for organizing this, and a huge thank you to all the doctors and to New York Health and Hospitals for initiating this important program. So just before I ask a question, let me start as a statement. I'm a 62-year-old woman, a reporter for many years. I too am a type 2 diabetic. I was diagnosed several months ago. Now, I went to a nutritionist who advised me to go on a plant-based diet, and thank God a million times over, I was able to bring down in the last 3 months my A1C from 7.9 to 5.5 with a lot of work.
That's great, Fern. I have to interrupt and say that's great. Right?
Thank you, Doctor.
We really love hearing stories like that.
Well, thank you, Doctor. And, it took a lot of discipline because, full disclosure, I was a junk food junkie. I was eating all the wrong foods, especially during COVID when we were all isolated and people were bringing me high-fat foods and junk foods. We all put on weight, and that, I think, tipped the scale for me. But, through diet, through exercise, I really feel that this plant-based diet is great. And for those people who are carnivores, who really miss their hamburgers and steaks, I have news for you. The Impossible Burger, which is totally plant-based, is just as good, and I really enjoy it every once in a while. And guess what? It doesn't have any cholesterol either. So I just wanted to, thank everyone for, talking about it. I guess my question for people who are getting familiar with plant-based diets and people who are battling diabetes, this is kind of a medical question. In addition to, of course, resolving to go on a healthier lifestyle, would any doctors also recommend, which I've tried, which helped me, is intermittent fasting as a way to resolve diabetes and so on? I'm wondering what the doctor's opinion of that is.
Nichola is our diet expert.
Okay,
Nichola,
great.
So,
Dr. Nichola, what do you say?
Yeah, so there isn't great data on intermittent fasting, although it does work for some individuals. I think, when we're thinking about diets, we're really thinking about what can someone stick to long term. So anything can really work for a short time period. And some people do have really good success with losing weight with intermittent fasting. But there are definitely different ways in which you can lose weight. And each of those ways will probably have some improvement in your diabetes. But the data on intermittent fasting specifically for diabetes, there's not a ton of data available right now, but there is some data on how intermittent fasting can help with weight loss.
Well, thank you very much.
Thank you, Dr. Davis. Thank you, Fern. Next, we have Ricot Dupuy from Radio Soleil. Ricot, you there? I think you need to unmute yourself, Ricot. Hold on. Yes, please unmute yourself. Unmute. Okay. Okay, we're gonna come back to Ricot. Let's go to Moshin Zahir from Urdu News. Moshin, you there?
Yeah, I'm here. How are you?
Hey, how are you, Moshin?
Good,
We're gonna
good.
go back to
So
Ricot after you.
So my question is like, for example, in our community, there are many people who are diabetic and many people who are having obesity problem, and they are under the care of their primary physicians. So they are not the patients of the city hospitals. So is there any way they could also be qualified for this program?
Absolutely, 100%. We have quite a few patients in our Bellevue program, for example, who see a primary care physician outside of the health and hospital system and who come to health and hospitals specifically for our program. So we can partner with anyone's primary care physician around the lifestyle piece. And I think, it is very important that we communicate so that the patient is getting a consistent message among all of their whole medical team. We want our patients to feel supported and get, so all of their medical team is on the same page. So we communicate with the outside physicians, and it's actually worked out very, very well. So all patients are welcome to join.
Thank you, Dr. McMacken. Now we have Caroline Pimentel from El Corazón de la Medicina. That means the heart of the medicine. Caroline.
Oh my God, I'm trying to open.
Caroline, you there?
Can you see me? Oh, I'm trying to open the camera. Okay. Hello, how are you? Can you hear me?
Yes, we can hear you. Oh, now we can see you.
Yes. Hi, everyone. I'm glad that you guys are doing this, especially you doctors. You're doing a very great job. And this is really good for our community, especially in New York City. Now, my question to you is, are you planning to expand this plan to other hospitals besides New York?
So I will say that there has been a huge amount of interest in this concept of lifestyle medicine and emphasis on nutrition in the past few years, and even in the past few days since Mayor Adams' press conference last week about our expansion. I can't tell you the interest that's come in that I've seen personally from other health systems who want to incorporate this. So I'm so excited about the future. I know that there's already a number of health systems across the country, and hopefully there'll be even more in New York who are using this approach.
Thank you, thank you. And you're planning to bring this to a school because kids is very targeted with the obesity and diabetes too.
Yes, I think that it is important that this education and this sort of support really start from a very young age with families. And so I think we as health and hospitals, we can play a huge role in terms of our pediatrics and our programs where we're working with parents and children. And I know there's been a lot of work already in that space in health and hospitals. And as we were saying before, even when we're treating adults, a lot of times we're also influencing how they're cooking for their kids and how they're inspiring their kids and modeling healthier behaviors for their kids. So it kind of goes in a circle that way. But I'm hopeful that there will be more efforts directly in the schools as well.
Thank you, Dr. McMacken. Sorry.
Yeah, I was just going to add to that, Dr. McMacken.
Sorry. Yes.
No worries. It also goes the opposite way. Like parents will make these changes for their children. And so it has that bi-directional effect. So sometimes just parents trying to help their children to make healthier choices, it also influences the parents' behavior. And we do have some programs already that focus in the pediatric population. And I really hope that we'll be able to grow this program into that population as well.
Thank you, Dr. Davis. I think Rico Dupuy is back. Rico, can you hear us?
Yes, I do. Do you hear me?
Yes, now we can hear you.
Thanks, Jose. Thanks for having me. We all know the value of plant-based food, legumes, fruits, vegetables, but these things are known to be full of pesticides. Now, do you have some recommendation as to how do we deal with pesticides? Now, does the benefit outweigh the risk? Speak to that for me, please. Thanks.
Sure, that's a really important question. I will say that all of the science that we have in nutrition, looking at, say, the benefits of fruits and vegetables and legumes, most of those studies are done with conventionally produced produce and plant foods. So we know that there's a huge benefit to consuming those foods, even when they're produced conventionally and not necessarily organically. There's probably some additional benefit to avoiding the pesticides if we're buying organic, but I always say, when I win the lottery, I'll buy everything organic. But until then, I'm picking and choosing, and frankly, for many people, there just isn't that access. So I want to be respectful and honor where our patients are coming from and what they have access to. But I definitely think it's a great point. I would also say that it's not just the plant foods that contain pesticides, right? So we know that. So for example, some of the meat that's produced contains pesticides as well. So it's really across the spectrum. But by focusing on a more plant-based diet, patients are really getting extra fiber and antioxidants and other phytonutrients that they would not be getting otherwise by not having those foods.
Michelle, I would just add, when they're eating meat, they're also eating a whole ton of antibiotics that they don't need. And that's one of the major harms that, I think meat eating causes.
That's right.
Thank you, Dr. Katz and Dr. McMacken. So we have the last two questions for today. We're going to go in a second round with Roberto Garcia from Opción New York. Roberto, I think you have your hand up. You have a second question?
No, it's okay. I was going to answer already with another question that did before. Thank you.
Great. So Amji Damlaki, Amji, do you have a follow-up question today? You need to unmute yourself. Angie, can you unmute yourself?
Yeah, no, thank you. They asked it already. Thank you a lot.
Great. So now I invite the panelists to, if you want to provide a closing remarks, Dr. Katz, Dr. McMacken, Dr. Davis, or Lillian. So please.
I'll just start by, again, thanking everybody for joining us. Thank you for getting out our message. And Dr. Michelle was talking about all of the calls she's getting. And I think one of the things we're seeing is the power of a spokesperson like Mayor Adams, right? And we've seen this at other times when famous people have come open about being gay or being HIV positive or having a substance use issue or learning from a mammogram that they had breast cancer, right? This has a huge impact. And he's just such an amazing spokesperson for, I had disease and the doctors wanted to put me on a variety of medicines. And I said, I wanted a different approach, and I found plant-forward diets and a variety of lifestyle medicine, and I changed my life. And so we're really hoping that events like this help us and you help us to get out the word, because it is not the medical model. And, I love being a doctor. I love taking care of my patients. The medical model is you have a disease, I diagnose your disease, and I give you a medicine. That is the medical model. And it's going to take some time for, doctors like Nichola and Michelle to get out the full message that there is another path. Medicines are right for some people and some diseases, but there are also alternative paths for many people, or complementary paths for people who need both. And we're just so happy to be with all of you to get that message out. Thank you.
Thank you, Dr. Katz. I couldn't agree more. And I'll just say in closing that just speaking very personally in my experience as a physician, I will just say that, there really, truly, in all the years that I've practiced, there's nothing more rewarding to me personally than seeing patients truly get healthier. I mean, being able to help patients and guide them in making these changes and work with them and really tailor it to where they're coming from. And every person is coming from a different place. And so taking the time to listen and understand where are the barriers that you're facing? What are your favorite foods? How can we work some of these healthier foods into your diet in a way that's delicious? We said how important that is, and enjoyable and affordable to you and works for your family. I mean, it's how can we help you sleep more? How can we help you reduce stress? Nothing is more rewarding than seeing patients get the support and take action and get healthier. And so I think with these programs, we're going to be able to do just that. And with a whole team support, because that's really quite magical to have the dietitian, the doctor, and the health coach, and potentially even more staff really surrounding the patient with support. Thank you all so much for being here. We're so excited to keep going with the dialogue, and thank you for getting out the message. I look forward to continuing to talk with you in the coming weeks and months.
And I'll just piggyback off of what Dr. Katz and Dr. McMacken said. Yeah, I mean, as a doc, there's nothing I like more than being able to stop a medication because someone has made such significant lifestyle changes that I no longer have to prescribe a medicine for their diabetes or their high blood pressure. And that is achievable. It may take a while to get there, but it really is achievable. And it's extremely, extremely rewarding, and it's gratifying for the patient because, they've really worked hard to try to accomplish just that. And just to really recognize how much they've improved, not just their disease, but their entire life, and they're feeling better, and, they're managing their stress better. And there are just so many, good outcomes, right? Their skin looks better, right? Because they've been getting so many vitamins from the fruits and vegetables and sleeping. And so they just feel better, and they're able to just manage their illnesses better. And it's really empowering too. I think, Lily, you mentioned before, it's not having these illnesses dictate your life, but it's how do you manage and really take control over your health. And diet, lifestyle, physical activity, weight loss, these are all really key ways. And we've known this, but now to be able as a health system to focus on this aspect of someone's health is really, it's really a dream come true, I think, for docs like Dr. McMacken and I. So thank you so much for being here and for helping us get the word out about this program to patients, because I think it really can be life-changing for patients in our communities.
And I'll also say, Dr. Davis, piggyback on what you said too. And I want to first thank you again, everybody, for your enthusiasm and all the great questions and engagement. It is such an exciting time. And again, as a dietitian, so great to be able to have this partnership between physicians and dietitians to really bring these tools And what the Dr. Davis just said too, one of the really key elements that makes me passionate about lifestyle medicine is this empowerment piece, you know, where patients are no longer passive recipients of care, right? But now they're empowered to affect each of these 6 pillars of lifestyle medicine to reach optimal health. Now, I really firmly believe that the kitchen is the greatest tool to promote optimal health and wellness. I really do. And so this, you know, being able to bring nutrition, plant-based nutrition at this level, you know, and sharing the enthusiasm that all of our physicians here shared around seeing the outcomes, you know, having patients come in and tell me how much their family loved this particular dish that we talked about and these spices and how do we make this, but then also having them come in and tell me something like, I was able to tie my shoes for the first time. You know, my doctor, my PCP congratulated me, you know, with tears of joy for both of them about how my blood sugars performed this time around. And she can't believe it, or he can't believe it. You know, to hear these stories, right, shared every week at groups, for me, it's such a privilege to be able to play a part, you know, and helping people to really get that they can do something about these conditions, right? And I'd like to also mention a word for our Latino community and our immigrant community, that there was a question brought up about it. One of the things to emphasize really is to see that plant-based diets are part of our history and a lot of our cultures, right? So I talk to patients about going back to our roots and eating like our grandparents ate, right? Regresando a nuestras raíces. Para nuestra comunidad latina es algo tan importante, tan especial tener este tipo de servicios, porque yo sé y he escuchado en muchos años de mi práctica tener estos servicios y la necesidad, en verdad, y el clamor de la comunidad latina para tener estos servicios. Y estamos muy emocionados de poder finalmente traer un equipo para tener toda esta información y ayudar a nuestra comunidad y a todas las comunidades que servimos a ser mucho más saludables. Thank you.
Muchas gracias. Gracias. Thank you, everybody, for their participation today. It's really, really a great event. We are looking forward to the next one. Have a great day. Thank you.
Thank you, everybody.
Thank you very much. Thank you.
Thank you.
Thank you.
Thank you.